An Introduction to Social Policy by Dr. Nick Wilmore. In this sixth part of the series, I'm going to focus very much on social work and social policy. As I come to the end of this session, it's beholden on me to look briefly at the role of social policy and social work. Why is it that social policy is such an issue for social workers? And I think part of that is that both arose from the need to challenge society to better meet the needs of the vulnerable. One of them at a policy level and the other at a practical personal level, but both very much intertwined in the same conceptual philosophical environment. In fact, social work has been defined by the delivery of social policy to create social justice in society. So there is some very definite links, I think, between the two. Once you accepted that social work is very much about delivering social policy, the debates then are about what is the impact on the social work role. What is it that the social worker should be seeking to achieve? And I think there are a number of ideas to start exploring in all of that. One of them is about what's the appropriate level of state intervention in society. And that comes to quite a fundamental positioning in terms of your political philosophy. Because if your idea is that the state has a role in supporting those who are excluded or disadvantaged, then you need somebody to make that intervention, and that's where your social worker comes in alongside other parts of the public service. Recognising that as social workers we're often dealing with those who are most excluded and have difficulty accessing the range of public services available. So that's if you have a view around a larger state intervention. However, if your perception is that the state should not be intervening in society, you move towards the small state concept and the big society. If I pinch David Cameron's slogan from 2010, as soon as you start talking about the big society, then the social work role as a representative of the state suddenly becomes much smaller, because you're not there to facilitate change, you're there to deliver a very basic service. The question then comes, well, how do we help people move on with their lives? How do we help people make best use of the resources available to themselves? And that then starts asking the question, well, should social work move away from being a statutory service and actually embracing a market alternative, much like you might have a financial advisor or a building surveyor who's helping you understand what best to do with your financial or property assets? Where's the social worker helping you with your personal assets? So it's an interesting philosophical debate, one that clearly at present in the UK we're not there yet. I don't think we've even started that discussion. But for me, looking at the different political philosophical models, that debate has to be had. There's also one about the role of local government, in that it's delivering a service to the community, often on the basis of a statutory definition of what that service should be, whether you're meeting the needs according to the Children Act or the Care Act or the Mental Health Act. It's got a statutory basis to it. But also sometimes it has more of a policy focus about actually giving people a voice in their own care, giving people a voice in how local services are developed. And that's when you start asking questions about actually whose philosophical framework are you working to? Is it the local authority one? Is it the national government? Or are neither of them very strong? And actually it's a more professional framework that comes to the fore. As I say, these are not right, wrongs, either or. I think the reality is it's a bit of all of that, which is exactly where we go back to Lipsky, because he's saying it's a tension, and it's one that actually managers, politicians, social workers and citizens have to manage that. Several years ago, Jonathan Dickens set out what he called the social work diamond. What he was recognising was that social work and social policy are seen in different lenses, different philosophical lenses. And depending on your perception, the role of the social worker, the role of social policy changes. So you might see yourself as a service user, you might see social work and social policy as being a bottom-up series of user-led activities. So it's seeing the development of social policy and the role of the social worker as very much based on the individual and responding to individual needs. Conversely, as a social worker, you may well see social work as being an expert-led service. You have the experience, you have the theoretical knowledge, you have what, to all intents and purposes, in the literature would be described as an expert perspective. And as such, being part of that elite, you know what's right. We all know actually the reality is that most social workers do understand about being expert-led, but recognise that actually you are only an expert because you are facilitating the needs of the service user, and that actually any meaningful real change has to be something that the individual and the user group are able to lead. There are other perceptions though. You may well look at it from the organisational one, that social work and social policy are delivered by large organisations. Well, I say it could even be a small organisation if it's got a very strong value and perception of itself, but where the organisational setting significantly influences the way that policy is delivered. I think in current society there is some of that. Different social work departments, different charities have different ways of working. But when you think back to the way that social care was delivered in the interwar years and shortly after the war, it really was very much an organisational policy developed in a way that was quite organisationally focused. And then you've got the state perception about, is social work part of the machinery of state support and state control? So you're then starting to talk very much of a top-down, autocratic, very tightly managed approach. And there are times when it does feel like that, when you've got politicians and regulations that are quite inflexible and very precise and do not allow any discretion in the way that they are being delivered. So the social work diamond tries to look at the different ways of viewing social work and social policy. None of them are pure. The reality, of course, is that you will always see a bit of all of them. but by understanding those different perspectives, being able to balance them in your response to any given situation. From these last couple of minutes, you will, I hope, appreciate how inextricably social work is linked to social policy, and that the conceptual element of it is based on not one but actually multiple layers, whether you perceive the role of social work as being to support users, to work within organisations, or to be part of the state framework that delivers policy, that delivers services, and delivers sometimes control over the behaviours of individuals. So it's quite a complex and a very ethically informed debate, and one that you won't be able to escape as a social worker working within certainly the public sector, but I would argue actually any social worker working with the UK has to have a significant element of social policy that informs their work, which they therefore need to be able to understand and to a certain extent anticipate.